Good day to everybody everywhere. Thank you so much for joining us once again for the Shang Shung Institute School of Tibetan Medicine webinar series. My name is Adam Okerblom, Doctor of Acupuncture and Oriental Medicine, and I will be your moderator today. We hope everybody is doing very well and having a good summer and enjoying so far as we are continuing to deal with the sequelae of the COVID-19 global crisis. And if you are here in California on the West Coast area with us here, then as you know, we've been dealing with some very serious wildfire damage in our state. So it's been some definite challenges, but we hope that everybody is staying healthy and staying well and staying on the positive side as much as possible. And so we're here to share a little time with you again today. So as we say before, the Shang Shung Institute School of Tibetan Medicine, we are an international school of traditional Tibetan medicine studies, offering courses and programs following the traditional teachings of Tibetan medicine and offering courses based entirely on the classical root texts of Tibetan medicine known as the Gyuji, as well as the commentaries. And offering our courses in accordance in the style of the traditional schools and universities in Tibet and India. So we offer programs at our United States headquarters in Western Massachusetts, as well as various other countries, Italy, Russia, Spain, around the world, both in person and online. Our programs range from short lectures and presentations to continuing education courses for healthcare professionals, all the way to our flagship program, our 4-year complete advanced training in traditional Tibetan medicine, which, by the way, is starting its new cohort this January 2021. And we would love to have you join us if you are interested in studying Tibetan medicine in a serious regard as a part of a professional career integration. Then please do look up our 4-year program, the Advanced Training in Traditional Tibetan Medicine. Also, if you're interested in learning more about Tibetan medicine or following us, we'd love to have you like and subscribe on social media, and please do join our email list for important updates and announcements. The Shang Shung Institute School of Tibetan Medicine, founded by the late great Tibetan scholar and Dzogchen Tibetan Buddhist master Chogyal Namkhai Norbu Rinpoche, and we are very happy to present to you, and we would love to have your input and collaboration in our international community of studies of Tibetan medicine. I also want to point out the American Tibetan Medical Association, ATMA, is the Tibetan Medicine professional organization for practitioners and students and supporters here in the United States. So ATMA is accepting memberships of professional members, supporting members in different ways. So if you want to learn more about traditional Tibetan medicine, find a qualified teacher or qualified program in your local area, or just support the general national community of Tibetan medicine, then please do join the ATMA, American Tibetan Medical Association. And ATMA is American Tibetan Medical Association.org. And then the Shang Shung Institute is going to be our homepage, our new revamped, new and improved homepage, TibetanMedicineSchool.org. So thank you so much, everybody, for joining us for the webinar today. Today, I have the privilege of talking with two women who are very inspiring to me and very dear friends and teachers of mine. And who are two of the original pioneers of traditional Tibetan medicine here in the United States and in the Western world. Both have traveled very far and had a long and storied career of traditional training and a long life journey, and both have been here in the United States dedicating decades of time and energy to present the traditional Tibetan medicine teachings and work with Tibetan medicine and integrate these teachings for the audience of the United States and the Western world. So I'm very, very inspired and happy to have our guests here today, our ongoing host, Menpa Phuntsog Wangmo, and our special guest, Dr. Yangdron Kalsang. So I want to tell you a little bit about our special guest. Dr. Yangdron Kalsang is a Menpa practitioner of Tibetan medicine. and a California licensed acupuncturist with a doctorate in acupuncture and Oriental medicine. Excuse me, just one moment here. Thank you so much. So, Dr. Kalsang earned her degree in traditional Tibetan medicine studies from the Tibetan Medical University of Lhasa, Tibet, her home country. And she earned her master's degree in traditional Chinese medicine from the Five Branches University and the graduate degree of doctorate of acupuncture and Oriental medicine from the Five Branches University. In the Santa Cruz, California, as well as in San Jose, California. She graduated with her doctorate degree in 2018. Dr. Kalsang is the founding member and the current faculty of the Shang Shung Institute School of Tibetan Medicine in Conway, Massachusetts, as well as one of the original curriculum developers and consultants in the planning of our certification program. That's our 4-year advanced training program. For the past few years, she has been teaching Tibetan medicine courses at her alma mater, the Five Branches University, offering a unique and brand new curriculum of Tibetan medicine studies at that esteemed University of Traditional Chinese Medicine, Oriental Medicine. And Dr. Kalsang is the founder of the Kunde Institute, which is an educational resource for traditional Tibetan medicine, as well as a fully functional Tibetan medicine clinic in the Daly City, San Francisco Bay Area, California, working with many patients and offering not just clinical services, but educational programs there as well. She has been an educational resource at the University of California, San Francisco, as well as the Stanford University medical students and faculty, as well as many Tibetan community centers and Buddhist centers around the Bay Area. And Dr. Kalsang teaches and lectures at many events and venues around the country. She has a strong commitment to better health and education, as she provides compassionate and effective healing services to the community while living in the San Francisco area with her husband and 2 children. Dr. Yangdron Kalsang, thank you so much for joining us here today. It's a pleasure to have you.
You're welcome.
And wonderful to see you again.
Me too.
And then as well with us today, as usual, we have our ongoing webinar host, Menpa Phuntsog Wangmo. Menpa Wangmo is a practitioner and teacher of traditional Tibetan medicine with over 35 years of experience in the field, teaching and practicing. She too is a graduate of the Lhasa University of Tibetan Medicine Studies, her home country in Lhasa area, Tibet. And she is the one of the original founders of the Tibetan Medicine program of the Shang Shung Institute, School of Tibetan Medicine here in the United States. She has developed and innovated and inspired the curriculum, the program for that school, and has also been the head instructor for many years. And she currently serves as the international director of the School of Tibetan Medicine at the Shang Shung Institute, as well as the head teacher, offering programs online and in person, and traveling prolifically around the world to teach Tibetan medicine. Menpa Wangmo has offered teachings across the United States, as well as in Russia, Italy, Spain, many countries. She has taught at many venues and events, and is beloved by many students all around the world. And it is a pleasure to have her with us once again today as our ongoing host. Menpa Wangmo, wonderful to see you. Thank you so much for being with us today. Excellent. And once again, and of course, we also want to give a special thanks to all of our translators and technical support. We have Matthew working with our technical support, getting us posted online, as well as our translators in various countries helping us to share these resources around the world. So today we're talking about pioneering Tibetan medicine in the West. Now, both of you have traveled all the way to a long journey through different countries, European countries, different parts of the United States, and finally settled settled mostly on two different east and west coast areas of the United States. With Dr. Yangdron La, you have kind of settled in the San Francisco area, and Menpa Wangmo La, you've spent much of your time on the East Coast in the Western Massachusetts. But both of you have founded institutes and founded projects together. You both are co-founders of the American Tibetan Medical Association, the professional organization, and you both have taught for decades, working with the teachings here in Tibetan, working with Tibetan medicine teachings here in the West. So this is really amazing, because Tibetan medicine has not had the many decades of previous introduction to the United States. It's still rather a new and fledgling type of practice. It's still kind of an early root and sprouting and growing stage, as opposed to other kind of holistic medicine and Eastern medicine that has been well established for many decades. So with Tibetan medicine, as you know, we have challenges of we don't yet have legal protection in terms of like accreditation of we don't have a kind of laws protecting Tibetan medicine, or we don't have kind of a scope of practice outlined legally in many places. And so we don't have also many, we have very few resources for educational programs. And so we're kind of really just working with circumstances and developing Tibetan medicine step by step as we go. And you two have been very instrumental in that. So thank you so much for offering those services. And we want to talk a little bit more about that today. So first of all, let's start with Dr. Yangdron Kalsang. Now, here in the Bay Area of California, we've been dealing with the restrictions of the shelter-in-place orders with the COVID-19 crisis, but now the local government in our area has started to begin to loosen up and reintegrate services. So tell me, how has it been affecting your practice, the shelter-in-place quarantine, and then how are you working with that? Are you able to see patients? Are you doing telemedicine? How are you able to offer services now? Give us a little update on that, if you will.
Okay, thank you. First of all, I'd like to thank, it's very nice to be back with the Shang Shung community, and I see Dr. Phuntsog often in the webinars, and we talk often, and Idam yourself, but with the big community of Shang Shung, great, and just to all of you, also to all of the audience. So to answer your question, yes, it's a quite challenging for closing down the whole clinic. There's a patient calling me all the time, and they definitely prefer to be seen in person, but because of the circumstances, it's not that easy. So I had to switch to the telehealth at the beginning of the year. But we shut down or locked down on the March 17th. And I just didn't stay still right away. I started working on offering webinars, offering webinars on Tibetan medicine, because the moment that hit of the coronavirus 19, although Tibetan medicine may not be directly treating coronavirus 19, but I know through the Tibetan medicine, deeply through the Yushe, there's a really clear description of each symptoms and very similar presentations of the patient that they're experiencing. And I might be even been treating some of the conditions we never been diagnosed with the coronavirus, but since last November, definitely, and cold and flu season symptoms are raised in the clinic, and I was seeing then until March. Then after that, of course, because of the lockdown, so I started offering webinars on Tibetan medicine, how Tibetan medicine can help for the coronavirus in different perspectives. We invited many Tibetan experts, including Dr. Wangmo here. and to share what you can do, not only as the medical treatment, but also what can you do at home since people are locked down in the house. Then along with that, we started setting up a lot of telehealth. And also I've been sharing the resources because I get those resource guidelines from Chinese acupuncture today. So I share those with my community back to Tibetan medicine group. And I tried 3 times to reopen in May, June, June, July, and finally I just opened up 2, 3 days ago. And people are waiting. So there's no time for us to wait because you need to take the precautions, you need to follow all the CDC guidelines, but also there's an additional thing that Tibetan medicine can offer that I am implementing them with the patients and also to our staff.
Wow, congratulations on being able to see some patients in person again. That's wonderful. Yeah, I'm personally really looking forward to that time as well, because as practitioners, I'm sure Menpa Wangmo, Menpa Yangdron, you would agree that it's very difficult when we don't have the chance to interact with our patients and work with them in the way that we're used to. It's really, we miss it a whole lot. So I'm sure that you are very happy, and I'm sure that your patients are very happy as well.
Yeah.
And yes, thank you so much for, we tuned in, of course, to many of your webinars that you offered, and you were really you organized that quite early on in the pandemic, and you had really, this webinars were an excellent response, and you were able to get some fascinating guests from across the kind of world of Tibetan medicine in different countries, and that was really inspiring. I remember we were discussing this was really inspiring and helpful. With some of those Tibetan doctors outlining the specific lines and sections from the Gyuji, the Tibetan medicine root text that may pertain very well to the COVID-19 crisis, and discussing all of some of those applications, which formulas we can use, which precautions we can take, discussing the theoretical basis. And so it was very interesting and helpful. So thank you again for bringing that up and for organizing that wonderful webinar.
I'd like to also thank for Robin and Tony were 2 of main backbone for me. Robin Sauter is one of our 5 branches advisor for doctor program. So she put a lot of time and energy talking to me, and she was the main drive for me as well. And Dr. Tani Tadwell, she has been into our lot of webinars. She put all the description, everything academically putting in the planning. So they all did a great job, and I appreciate everybody who helped.
Yes, absolutely. Those are 2 people who are very beloved supporters and involved in the Tibetan medicine community that we really appreciate very much. Well, again, thank you so much, Dr. Kalsang. So let's go to Menpa Wangmo. Menpa Wangmo La, thank you so much for taking time to host this webinar with us today. So same question for you. We've had all the precautions of sheltering in place, all of the challenges of the COVID-19 pandemic. So what are some of the main things that you have done to work with your patients and students and community during these times? And is that starting to shift, or is it starting to change now, or still quite the same situation? How about just a few updates from your end of the spectrum, please? And please unmute your mute. Yeah, there you go.
Thank you. First, I want to say thank you. And then as my best friend, dear friend, Dr. Yangdron mentioned, since we worked since 2001, approximately 2002, we started work together. And then now, again, we are here with the Zoom. through the Shang Shung Zoom webinar. It's really is nice. So I always wanted she come back to with Shang Shung. So this is also the first sort of like she's always been with us, but today is more like the visible with us. So I want to say thank you, which is very nice. And then answer Adamla your questions. Yeah, the pandemic is challenged everywhere, everyone. I think it does not matter where you are and then who you are and which kind of lifestyle you have. I think everybody is very, some different degrees of really affected. So in our cases, we are still sort of like our center is still not officially opened yet. So we're still sort of like a semi-lockdown because it's we have many of our community members are senior, included myself. So we are sort of like still officially not opened, but is that the patient cases, the people who had the problems. So since the last January, I mean, not last January, yeah, this January, the beginning arrived, this pandemic started time I was in Russia. Then I arrived in Spain, started from Spain. I tried to focus more to making a formula to prevent from the COVID-19. That was the sort of like my main focus. Because it's when I was in Tibet, 1980s and 90s, so also in our region, we had several like this kind of like a contagious disease, not strong as like now. But at the time also I'm making certain like the herbal formula tea to sending the remote area. And then mainly I was working in the Eastern Tibet remote area. So I have this kind of like to making the formulas, tea forms to help people. So that was my main focus. So started from Spain. We had a big gathering of the communities around the Tibetan New Year. So we made the tea and then served the people. So we had hundreds of people to having the tea every day. And then somehow I got back to United States, and then immediately sort of like I started to make the tea. And then I sent it to our communities. We have here two communities. One is that my Tibetan communities, one is my Sangha communities. So I send it to my Sangha communities, also my Tibetan communities, whoever wanted to have the tea, come to get the tea at the outdoor, like the porch. And also I sent that same tea to many other states. So I sent it to thousands of people. So that was like one of my main focus. The meantime, people who already having certain like the symptoms or the feelings, and then also we try to give the herbs, but working through this. And then when I'm working with a patient, in the Tibetan, we don't call so much the patient, but as a friend, so like who needed the herbs. When we're working with those people, the beginning time, there not so many people has like like a diagnosed by the Western medicines. Still, they have like symptoms, but is not like the positive or negative by the Western medicines. But the later people, by the end of the March, beginning of the April, and then especially like May, then people comes or calls to us. I mean, comes means it comes through the Zooms. Okay, so we are not physically. So then those people has sort of like the positive by the Western medicines, but there's not so much things to offer. So they want to see what the Tibetan medicine can do. So these kind of things we able to help whoever is contacted to some degrees, we able to help them. So that was really is very honored. This time really I honored to, I have this career, the Tibetan medicine, which is very simple, very applicable, very live. And you can do a lot of things into your kitchen, in your kitchen with your hand. So this something like the knowledge or the experience I able to offer does not matter which culture, which gender, which races. So this is really, I'm so grateful. So yeah, we are doing that. And then now in our area, in our community, Tibetan community in Massachusetts, I mean West Massachusetts, also my Buddhism community or my Sangha community in West Massachusetts, hardly no one sick. So hardly I never heard someone sick. So this also I'm so happy.
Yes, absolutely. I'm very happy to hear that as well. Yes, yeah. I'm glad you mentioned, we were very excited when you developed the herbal formula specifically to work with the managing the symptoms and the preventions for the COVID-19 potentially. It's an important point to understand in the realm of kind of all across the boards in traditional Eastern medicine, and certainly in traditional Tibetan medicine. We have these methods of treatment with the herbal formulas and other treatments that can be very applicable to these viral diseases, to these pandemic contagious illnesses, when we oftentimes in Western medicine will be not having very many treatment options. If it's a new virus that they don't have really categorized and studied yet, then maybe there's not a vaccine yet. Maybe the antiviral therapeutics in Western medicine are not as effective, or you need an upgraded version, or these kind of challenges, or there's side effects, or is very expensive or not very available, like for example, with the shortages of testing that we had. So to deal with new pandemic viral diseases, Western medicine has many very difficult challenges, of course, as we're seeing now. And we never say, in Tibetan medicine, we never say that we have a cure or a really effective treatment or something kind of, magical or for any of these illnesses. However, we do have many centuries of time where we have used the herbal medicine and used the traditional therapeutics to work with these kinds of pandemic diseases, because viral pandemics have been ubiquitous, very common in human society all through the millennia for so long. And in traditional Eastern medicine, we have very specific theory and methods and herbalism that work with these issues. So it's very common that we can have some herbal formulas or some methods that can have some benefit and can be really helpful part of the spectrum. So thank you for your work to make that available and spread that around. And that's one of the things I know for myself, that is one of the themes that we really try to promote and let people know, that we have some tools that can be very helpful in these cases. Okay, so yeah. So, here's one question for both of you that I really wanted to to discuss a little bit. And so I know that both of you are traditionally trained from the traditional Tibetan Medicine University in Lhasa. If I'm not mistaken, you both went to the same school, the same university, right? And were you in the same cohort, the same class together, or a couple years different, or exact same, or what?
So I graduated first, so maybe I will tell you first. So no, we are same school, but is that the different time. And then when I went to school time, still our school is a journey to the sort of like university, sort of this kind of like the level is not still yet, because we are just everything like the like recovering all the systems. So after I graduated in the 1988, and then our school is finally sort of like officially transform into the university level. So then I think that the Dr. Yangdron's group is the first batch or second, I don't remember. But then their group entered. But is we are like a lot of teacher is that the same teachers, special like at the time when we are in the school time, we are so fortunate. We had such amazing, great teachers. So those most of those teachers is today is not with us anymore, but is at the time is very valuable as like human, human dimensions like it. So yeah, many teachers we share, but it's the different time we graduate. But is that the curriculum study system, everything is the same, I guess.
Right. So, and then so at that time, as you mentioned, the Tibetan Medicine School was kind of reorganizing, kind of reinstituting and able to become a university again, and after a period of reasons and challenges. And so in a certain way, you two were participating in a kind of the rebirth or the relaunching of Tibetan medicine, even in your home country, and then coming to launch for the first time in United States. So a lot of pioneering work here, I see.
Yeah, not only that. As Dr. Phuntsog said, she graduated from the Tibetan medicine. At that time was a kind of like a vocational training. So like a 4 years vocational training, because that was the highest one we had. So she graduated in 88. Then I went into at that time was the first year of Tibetan Medical University in 89. I was one of the, as Phuntsog mentioned, one of the first one who first graduated from the first title that they called Tibetan Medical University. So there's 2 levels after Dr. Phuntsog's. Then they put a Tibetan medicine under the Tibetan University. So they were never being independent for maybe like 8 years. Finally, in 1989, they made into Tibetan Medical University right in Lhasa. So I graduated from high school. But then it turned out after she left, so I heard about her from her brother, who tended to be my teacher. And he was one of my teachers for last 3 years of medical schools. So we built the connection there.
Yes. Wow. Yeah, absolutely. So, Dr. Kalsang, when I was in school at the Shang Shung Institute and having the honor to learn from Menpa Wangmo, many times she would tell us stories about back when in the traditional training and when she was in school. And there's a lot of kind of inspiring stories and really interesting culture. And most of all, kind of reminders that we should study really hard, because back then they were very strict and you studied very hard and this sort of thing. Will you please tell us just a little bit, just a few words, from your experience with your education in Tibet? Because I think our audience is very interested to know kind of what it was like to study Tibetan medicine at that time in the Tibetan Medicine School.
Okay, sure. So one of the common method of studying Tibetan medicine, we even have a kind of like a nickname, like there's one bug that flies under the night light. What is the bug? The
Moth?
oh yeah, almost like moth. So what happened is we have to memorize a lot of text, mainly the Yuxi, especially for the Yusum, three of them. So early morning and evening, we have no choice, but also was really pleasant to memorize those text. So we would be spending most of time memorizing, especially for the first 3 years. We get up really early, like even in my family, I probably get up around 5:30, 6 o'clock every day. And in the evening, we go to bed really late. So you have class around 5:30, 6 p.m. The school has a dinner. You go to buy your dinner, you get your hot water, everything ready in a thermos. Then we have a long night. Then there's even between 7 to 8:30, we have a gathering together, students. So we call Gyorta. So you come together, all students come together, then you memorize what you have memorized. You go through 这句些语 all together. Then after you finish, that not end of the day, then you maybe go bathroom break for 10 minutes. Then you're heading on your way out to look for a night light, because by 10 o'clock, our school light will be shut down. So everyone, they expect everyone go to bed, or they have to study anyway. So we all go out of the campus and look for a night, how to say, the light. So we all memorize underneath. So that probably will take place another 2 hours, 2.5 hours. Then you come back, have a little bit tea or whatever you need. You starting to get ready for bed. So you literally get a sleep like 5 to 6 hours. So that's a really true. Then in addition to that one, we, as Dr. Phuntsog mentioned, we're really lucky to have those senior doctors. They really worked really hard, because in between, during the regular hours, they have to teach in the classrooms, but at lunch break, they wouldn't, like in Asian Chinese university system, you know, we have a lunch break, like 2.5 hours during the winter, and summer we have a 3.5 hours lunchtime. So school provide the lunch. So once we finish lunch, it's supposed to be nap time for 2 hours or 1 hour. But Tibetans don't like to, especially my teachers, don't like to take a nap. Plus, you know, in Tibetan medicine, we take a nap during the day. It makes right, increases your ignorance or too much. So my teachers like Kemputoro Tsenam, Gen Champuchilela, and there are many other seniors, they take turn to teach students. So they actually teach at their not clinic, their private house, or to old community of Minzakan. So some of them teach astrology, some of them teach astrology or other form of Tibetan medicine, additional training. So they do a lot of, they did such a wonderful training. I really miss those days. I wish I had done more still.
Sounds like you did quite a bit of studying. So with that kind of schedule, it's a good thing that you guys began those studies at quite a young age. Here in the modern times in the United States, when we go for the graduate school to study advanced, Eastern medicine or something like this, many of us are a little older. Many people already have a family. Many people already have another job. So it would not be quite as feasible to have that intensive of a schedule. But when you guys were in school, you started at quite a young age, and they really worked you with a lot of expectations. No.
Yeah.
Wow, cool. Well, that's really inspiring, and it sounds, like a very special program. Menpa Wangmo, can you tell us a little bit more, add something to the story, just whatever you'd like to share about what was it like to study in the Tibetan medicine when you guys were first in school in your training?
Yeah, basically it's as that the Dr. Yangdron mentioned, we are sort of like, in general, I think any kind of like a medicine study is very hard, but especially the Tibetan medicine, I think one of the toughest, hardest is studies. We have several universities around us, our school, and then lots of city peoples citizens, Lhasa citizen peoples, they always sympathy to our school students. Somehow they really respect our student because of we had such great teachers. Under the name of the teachers, they believe, they think also the student must be similar because they're training. So this kind of, we get a lot of like sympathies or support things. But in the meantime, also the school study time is very hard. So my time is we never stay on the bed later than the 4:30 a.m. 4:30 a.m. we are on the road, and then never went to that during the 5-year studies. I never went to bed before 1 a.m. I never stay on the bed later than 4:30. So what we do is like put the Gushi books under your pillow. And then when you woke up, pick up that, put the feet in the shoes, and then wear the jacket. Whatever you want to change clothes, we change the night before. So we know that tomorrow we don't have time to look in clothes and then finding and then changing those kind of things. So the school system is hard. But what I really like, what I really is today, sort of like when I'm memory go back to my study time, we had a very good relationship between the teacher and the student. So in the Tibetan, in general Tibetan subject studies, there are a lot of like that honor the teachers and then this and that. And some culture, they say, no, it's a teacher, is a student, the teacher is the same levels, and then the student need to say whatever they feel. That's really true. We need to say everything what they feel. But there's no sort of like between the student and the teacher, often we don't have sort of like the heart connections. That's what I see. In the Tibet, the teacher is very tough. Why they're tough? Because they wanted their student learn the best knowledge. Because in our case, when we were in the school, we had all the students came different regions of the Tibet. All the students is sort of like teenagers. There's no parents is close, and the teacher is sort of like they're acting as like also parents. They check not only that how we get the knowledge, but also our conduct. So if you're not studying, we get the scolding. If you are drinking something, alcohol, whatever, oh, we can get the scolding. If you go to a party or this or that, if you're spending your time is useless way, also we get the scolding. So we get a lot of scoldings from the teachers. When we're looking, they're really taking care of us like the parents. And then what the head of the Lhasa Menzikan, what he do? And then sunset, the night comes, and then he go to the Lhasa city, all the nightclubs, where is the bars, to see there's Tibetan medicine doctors, Lhasa Menzikan people, or the student from the Lhasa Menzikan. If someone there, he grabbed ears and he brings back to the school. Because he's not paid for this kind of thing. He's not a security. But he do this time to time, so then no one able to go there. Because no one go to the bars, no one go to the, because to become a doctor, there's a lot of not beyond the knowledge, we need also a lot of good conducts. Can imagine, doctor is drunk and they're treating patient is, we can understand, And the same time also student, far from the parents, taking this opportunity. If you spend the time in the bar or useless way, time passing, knowledge is not getting, then as Adam, like you said, it's get older and the older is more difficult. So this really, when I go back to my own memory, the relationships what I had with my teacher is really, that's really, I feel is still is very honored. So I try also, now I became like a teacher. So I try to do same thing to my students. Sometimes I scolding them. Sometimes I scolding them as a group, as you know. And then sometimes I scolding them as individual way. And then, yeah, if you are really sincerely, I think they understand. It's, even it's it does not matter which culture is, but they understand. This also I really appreciate that what I have student now in the West, how they respect to me. And also I honored really is how my teacher was kind to me, and then how they take care of us. This really is, I feel like, a special compared with the Western culture study and then the Tibetan culture studies, in probably the Eastern culture studies.
Yes, I absolutely agree.
Yeah,
And
you
I
remember, no?
can, yeah, yeah. Well, I can attest firsthand, this, no, you never scolded us too much, just a little. And I know that some of the Western style, attitudes
Yeah.
was very challenging for you, and then you had to really adapt a lot to learn how. You must have been saying, how am I supposed to deal with these strange Western people? So I think you really learned to adapt to our kind of special needs very, very well. But I wanted to say, this sort of cultural attitude of the respect and the love and relationship for the teacher. This was really one of the most precious and valuable aspects of studying Tibetan medicine for me, because in my experience in the West, here in the United States, going to college, yes, of course, you respect the teacher, and sometimes you really like a teacher, but also it's very common for the student to be very demanding, or to it's no problem at all to skip class, or this kind of thing. And so we have a kind of a sense of entitlement for the students at colleges in the United States. And then in any case, you also have very limited time interacting with your teacher, and it's kind of can be very formal or transactional sort of relationship. But when I came to study at the Shang Shung Institute, we were able to cultivate this really beautiful connection and relationship of just kind of a new way of understanding the respect and the collaboration between the student and the teacher. And I know that myself and my classmates, we really learned and grew a lot from that and appreciated that very much. I think it's very valuable indeed.
Thank you.
So, okay, so you guys had this traditional training, and then you came to the Western world and began to share Tibetan medicine. So I would like to ask you guys to share a little bit about that. And Menpa Wangmo La, I personally know a little bit about your story. So actually, can we first start with Menpa Kalsang La? Dr. Kalsang, would you tell us a little bit about your journey coming to the United States and beginning to share Tibetan medicine? Because actually, come to think of it, I don't know anything really about that original story for you. So would you please share a little?
Sure. So I when I first came in '97, I had a goal to study Western medicine. One of the reason is because in Tibet also it's a really modernizing. So all the new graduate, when they see in a hospital, if you don't know some Western medicine, they kind of look you down also. And then there's a time that when I graduated, I was 22 from University of Tibetan Medicine School in Lhasa. So I thought, although when I was there, one of the fourth year and fifth year, we did have some curriculum on Western medicine in Chinese, taught in Chinese, but the information is Western medicine. I did study that, but you cannot know too much. You only learning physiology, anatomy, and pathology, those three things. So I wanted to know more about Western medicine, and I really liked Western medicine myself in another round. So, but in order for me to learn Western medicine, I had no English, so I had to start studying English. So I, instead of going to medical school, I went to ESL school in UC Berkeley. They had an extension. So that was my original school. I came as a student visa in 97. So I was taking classes, then I had all the international classmates. So one of the girl, we have to read a lot of newspaper, then read back to the teacher next day a report as a part of ESL learning. So one day my friend brought one special article that Chinese medicine, acupuncture especially, is going to be licensed, not licensed, being paid by the insurance. So she brought this to me, and then I started to reading what is that about, because I also liked acupuncture myself, even when I was in Tibet, and we had also some acupuncture classes there too. So so I started reading. Then I was realizing, oh, I studied Tibetan medicine for 5 years. In addition to that, I had a family background, and people are here rising to interested in learning acupuncture. They're starting from zero. Like for me, I'm starting from zero to English. They're starting from zero, knowing no Chinese, to learn Chinese medicine or acupuncture. So I thought, oh, okay, in this case, maybe I really liked the Tibetan medicine myself, but then I wanted to use Western medicine to complement. However, I changed that direction into acupuncture instead of the Western medicine because of language, because financial, other purpose, other reasons. So I couldn't really go to the what do you call it, the Western medicine school then. But then that's how I started the first journey, make the U-turn back to Asian medicine. And when I was doing my internship in Lhasa and in Shigatse, and I focused a lot on the almost like a healing part, like integrative medicine. So the integrative medicine in our part is the acupuncture, then Tibetan medicine. So we use a lot of external therapies. So I spent almost like 8 months, 9 months during the internship time. So that's how I started learning Western the acupuncture. I integrated them together. Then I started to pursue the acupuncture school here in the United States. On the other hand, I was lucky enough to be invited to be one of the Tibetan medicine teachers at Five Branches University. That was in Santa Cruz. So ever since then, I could start teaching Tibetan medicine. Then I met Dr. Phuntsog since 2001. So we actually been rooting really well to work together to work on the Tibetan medicine. So did a lot of public teachings and school focus on the Tibetan medicine to teach in the acupuncture community. Yeah.
Right. So you were able to begin to offer teaching Tibetan medicine at the acupuncture school, and first at the in kind of the master's program, and then later on at the doctoral level as well.
Yeah.
Excellent. Yeah, that's amazing. That's really, yeah, I think that if you were starting from ground zero of English language and then to go all the way to get an MD, that would be, probably would take so much longer in
Yeah.
order to accomplish that is a very big deal. So to go into studying the acupuncture, and now you have this legally protected license practice, and you're really able to flourish here in the Bay Area. And actually, have had the honor of spending some time at your Tibetan medicine clinic in the Daly City. When I first got my acupuncture license, when I very first got my license, was very new. Dr. Kalsang was kind enough to invite me to help her, assist her a little bit at her clinic, and I was able to get some wonderful experience working with her patients and learning from her. And she has this amazing clinic where she's really integrating the traditional Tibetan medicine with some of the modern acupuncture style. And you can see her patients are very appreciative and it's a really wonderful thing. So I got to learn a lot from her early on in that clinical application. So wonderful. Well, thank you so much for that. So Menpa Wangmo, can you tell us a little bit about your journey to come to the United States and begin to teach and work with Tibetan medicine here? How was that for you?
Thank you. Yeah. So journey to come here is there are two reasons sort of like end up here. I mean, yeah, and then the beginning to the west, sort of like the main reason is that my teacher Namgyal Rinpoche, he's my guru, so he asked me to come to the west and to teach the Tibetan medicine. That also was sort of like one of the reason I studied Tibetan medicine. So that is the one reason I end up, first I end up going to Europe, and then second, I end up coming to here. So when I graduated from my school 1988, I was just like 18 years old, turning to the 19 years old. So I was pretty young. But I went to work in Eastern Tibet, like the remote area. So when I got into the remote area, so we had a lot of like where I went is like a nomadic region. We had a lot of like the people injured, not like injured by car or motorcycle at that time, but it's mainly like fell from the horse or kicked by the horse. Or so anyway, there's a pretty big number of the injured people. I'm not able to help them because my knowledge or my capacity wasn't enough. As Dr. Yangdron said, before we graduate, also we had this like the Western medicine, like a half year or 1 year, something. We had some informations about the Western medicine, but it's a Tibetan medicine, the Western medicine, both the knowledge I'm not capable to helping them. So always I wanted to go somewhere to learn a little bit of how to netting and how to like stitch, give some stitch things. And then go back to the remote area, work for there. So that is the idea or my goal was. And then on top of that, Rinpoche invited me to go to the West. So then I thought maybe this is a good opportunity. If I go West, maybe there is a big chance I learn. So then I went to Italy. Then somehow I end up in Germany when I reached to the 20 years old. So then my goal, so I found a place where I can have the study and then entrance for the surgery. So I did that. I stayed there almost a year, taking these internships with like under that in the Frankfurt, there's a huge gigantic, it's like the hospital, the Frankfurt People's Hospital. So I'm doing their internships, and then I'm studying under one professor. He also like the medical professor. Then he has many other clinic things to do. So I'm following him mainly. And then when I got in the medicine there, the first day I went to internship, that day they did a surgery to someone. One is the imputation, so like imputed like the one leg. It wasn't happy for me, but that is needed. And then removed one gallbladder. So I wasn't sure why they're removing that. And then, yeah, of course, my German is hardly zero. So I'm just communicating with the doctor with the Italian language. Then between during my intern there, and then they're removing many gallbladders. There are thousands of like a gallbladder removed. And then the last day of my interns, again, this 80 years, maybe 90 years, this very old a lady came. She already doesn't have one leg, already did amputation. They said 2 years ago they did. And then at that time, it removed another leg that they also imputed. then that made me so sad. Somehow I felt so bad. And then I asked myself, why they remove all those gallbladders? In the Tibetan, a simple Tibetan medicine, we have plenty of medicine fixing the gallbladders. Why everybody's gallbladder removing? Then I'm asking to my teacher, they say, it's okay, they don't need it. I think, why don't need it? So this is also like the one sort of like the teacher are such great. They helped me a lot, all those things. But then this one is sort of like, yeah, I sort of like stay with the Tibetan medicine. So that made me sort of like don't have desire go continue study Western medicine. So that was sort of like, and then yeah, the due to the Rinpoche's orders again, I came to after I went to the Europe, I went back to Tibet. I worked as in the remote area doctor. And then in 2000, again, the Rinpoche sent me a letter saying, now you go to US. So then that way I end up here. So this is the how I end up to here. So that's it. Or you want me to say why I'm doing here, what I'm doing here?
Sure. Yeah, actually, that leads right into our next question. If you still feel like talking for a minute, so when you came here, I believe you started to work on Namkhai Norpo Rinpoche's one of his big projects. As we know, Rinpoche founded several international organizations for cultural study, for humanitarian aid, for spiritual study. And then one of them is our institute, the Shang Shung Institute International. And so if you like, would you tell us how you started working there? And then just kind of give us, you don't have to spend, this is a quite long story, but just kind of give us some highlights about how this program developed and then spread. Now you're teaching around the world with many students. So can you tell us that story?
Yes, thank you. Yeah, you are right. It can talk days, but it can
Long story, huh?
it's
a long story, yeah.
Yeah. So I came to 2001, as Yangdron said, is zero English. So I also end up going to at the GCC in ESL class. So the original when I came here, my promise is stay only 1 year. So that was my idea. Stay 1 year, 6 months study, 6 months work, go back home. And then my main idea is go back to the remote area to work there because is they're sort of like I'm pretty useful there. Then 6 months went to school to study English, nothing happened. Another 6 months went to study English, also not so much things happened. Then end up going to 3 semesters, finally finished like the level of the college they call sort of like finally finished the ESL anyway. So, and then during that year and a half, I see there is sort of like two things. The Tibetan medicine practitioners, they say is still the medicines are not recognized. Even you cannot call you as a doctor. Okay. Okay, this is one thing. The other hand is that the people who did just a few workshops, they are working as the Tibetan medicine, giving the medicine this and that. So this kind of see sort of like 2 pages, like one fully trained people cannot practice, even cannot keep their identity, sort of like. And then the other hand, just one is hardly nothing trained, but they can do something. And then I really found is that in the Western people don't have idea what is the Tibetan medicine because they believe is so if you attend a few lectures and then attend a few Buddhisms, then looks like you can practice as the Tibetan medicine doctor. So then that is not the case. So then me and then my friend Yangdron, then sort of like I talked with her, said, is this is not right. So ABCD reason. If something happened, and then the name who get the Tibetan medicine get the names. And then not only Tibetan medicine get the name, but is people's life. So we should do something. So then that was sort of like, I really wanted to open a school, train the qualified people, and then to people, Western people later can see what is that the Tibetan medicine is, how long need to study, how many books need to study. To become a Tibetan medicine doctor, what is that means? So then, yeah, me and my friend, Dr. Yangdron, then we worked, her English is much better than my English. So then I'm writing the curriculums into Tibetan and she's helping me translate into English. So then we spent that sort of like almost 1 year, because it's at the time in the school, at the Shang Shung school, we just have the short programs, sort of like the introductory programs. And then also I said, board of the Shang Shung, I said, if we keep this kind of program, I will go back to Tibet, because there's no point if we don't have a qualified a person trained, and it just a little bit information is like in the food, like salt or spices. The spices or salt in the food is cannot keep the name of this thing, you know. You have to have main dishes. On top of that, yes, we can have many other elegant dessert, but is we have to have a one main dishes. So then that is sort of like a, yeah, then later also that the board proved and then supportive. And then in 2005, we opened the Tibetan Medicine School here in the Western Massachusetts. And then we got 6 students, I think. And then all 6 students is perfectly graduated. And then, yeah, that was sort of like that the first sort of like steps. And then meantime, to teach the Tibetan medicine in the West. Some people say, oh, you should not teach all those kind of things. You just teach the useful things. When I'm reading that the Yushi books, every word looks like useful. I don't see any there's useless words in that Yushi. Yushi has like 190, 156 page, the chapters over sort of like 600 pages. I don't see any useless words inside that book. So for me, is every word is sort of like such a useful. So then I decided to teach is how I learned. How I learned from my teacher, teach that way because that worked for me. Also, I so like connect to the student, how I had the connections with my teachers. So then this way I decided to do. And then meantime, to see our student is the qualifications of our student. And then me and the Dr. Yangdron's, and then our sort of like goal, or the what we see is like the no matter where you study the Tibetan medicines, under which kind of language, need to be is like the same qualities with who studied in the Tibet. Otherwise, there's no reason. So then due to that reason, then also we try to make the connections to the Northeast Tibetan Medical Universities in Tsongun. And then from that time, like the first our graduate student in the 2009, so we went to Tibet for our internships. And then we take the, under their curriculum, under their standard, they take the final exam in the Tsongun, our student. And then if they pass the exams, then they give is equivalence degree. If they're not passed, then we don't get nothing. So for that reason is we, every sort of like a graduate student up to now, we went to Tibet and then we had the 3 months internship and then we take the final exam under their curriculums. Because that I really value a lot, because is like Adam, like you graduated Tibetan medicine. One Western medicine doctors or Western person say, oh, your medicine is Tibetan medicine is not qualified. And we don't care why, because as they do not know Tibetan medicine. They know a lot of things, but they do not know the Tibetan medicines. The one Tibetan medicine community say you are not qualified, then that means it's bad news. So if they say you are qualified, then that is a value for us. Even at the moment, our school is like still sort of like not what do you call it, accreditation yet. Our Tibetan medicine is not like recognition,
License.
yeah, licensed yet, but still for us is important the qualities, not the of course name is important, but the main is important the qualities. Yes, we are working for that. And then we have sort of like pre-progress. I'm not saying it's such we had such big success, no, but we had a good things like now Adam and then Matthew, two of you is our graduate student tirelessly working for the Tibetan medicine, also like many other things, so other students. So this is what I believe is our result. So we have the younger generations.
Yes, thank you. And now, due to your work and due to Rinpoche's vision and due to Menpa Kalsang's work and the other contributors, now we have the full program, and so we can have a main course, like you said,
Yeah,
to
yeah,
satisfy the people who.
exactly. Yeah, exactly. Because what I do, everything is sort of like under the guidance of the Rinpoches. This is sort of like that the Shang Shung's one of the main commitment or one of the main sort of like way of the work is whatever the Rinpoche wanted, because Rinpoche wanted is very simple. All those enlightened beings, all those great masters, their wish is to benefit to the humanities. That is their wishes. Inside that, protect and preserve the Tibetan culture as well as, because why we want Tibetan culture protect and preserve, because Tibetan culture has a huge benefit to the humanities, not only benefit for the Tibetans or one or two peoples, no, or one or two groups of the people, no. We says like 6 million Tibetans. The Tibetan culture is not only benefit for the 6 million Tibetan peoples, they benefit entire world. For that reason, that is all those our masters included my Guru Nangano Rinpoche, his wishes that, so we try to move under his wishes, under his guidance.
Yes, absolutely. Thank you so much. Yeah, so we have our school, and how I feel so fortunate to be able to participate with the Shang Shung Institute, and I feel so confident in that diploma is because we have those main factors of qualification, like you said. First of all, if you look at the Shang Shung school curriculum, you can see very clearly it's derived following the Gyuji directly. Number two, our head instructor, Menpa Wangmo, there's no doubt your qualification. Then our founder, Chogyal Namkhai Norbu, not only our personal spiritual teacher, but also one of the most important Tibetan scholars and Tibetan cultural scholars in the world for many decades. And then finally, as you mentioned, another important thing, our internship program with the Tsongon Menkong, the Tibetan Medicine School in Tsongon in the Amdo region through the Qinghai University, then this is also this qualification. So for all these reasons, I am very thankful and confident in our school. Okay, thank you for sharing that wonderful story. So, Dr. Kalsang La, you
Yes.
have in addition to your offering Tibetan medicine through the 5 Branches University and your innovative and thriving clinical practice and your participation in the Shang Shung Institute and all of these things, you and your co-founding of the Atma, you also have another really exciting project that you've worked on, which is your collaboration through the Stanford School of Medicine to offer the Tibetan and Western Integrative Medicine Symposium. For several years, you have organized just a wonderful gathering of minds and hearts for the gathering of Tibetan medicine scholars and Western medicine professionals, and had this wonderful symposium held at the famous Stanford School of Medicine. So would you please tell us a little bit about that project and how that started, and what you've done, and maybe what is next for that?
Okay, thank you. Yes, speaking of the Stanford Integrative Medicine of Tibetan and Western Medicine Symposium, all started in 2015, where Dr. Phuntsog Wangmo and Chogyam Namkhen Rinpoche invited me back to Tenerife in Spain. So they hosted and organized integrative Tibetan integrative medicine conference down in Tenerife and Barcelona. So it was a delight to see her there and the Rinpoche, but it was a quite long trip, right? So on the way back, I was thinking, wow, we live in the right middle of the Silicon Valley, and we have to go to that big conference down in there. Why can't we have something here? That was my original question. So I started to initiate with this question and starting talking to one of my collaborative director, Dr. Art Johnson at Stanford, who just retired, but he used to be the director of the clinical family medicine department at Stanford. So I just purposely called him. I went to see him. I said, look, I just came back from there. The conference was wonderful, but why can't we have something this here? So that's how we just started to develop this idea. But going backward, I just want to share a little bit how Namkhen Novo Rinpoche, how I met Namkhen Novo Rinpoche, how I met Dr. Phuntsog. Before her, I met her brother. So I want to make this link also. So I have never met about Namkhen Novo Rinpoche until 2001. But I heard about his book about Z Tengwa is the one famous Tibetan book by Chogyam Novo Rinpoche. So when I was in medical school,
the necklace of Z.
oh yes, yeah. So when Rinpoche was, he was in Italy, but his book was written. So somehow it got in Tibet, and in our school they're asking to distribute. And I think project manager maybe is Dr. Phuntsog's brother, but I didn't know. Anyway, I was part of the student volunteers, so I did a lot of distribution myself, and I held the book with me. And even if I didn't know much about it, I was very happy to do that. So that was the initial connection with the Rinpoche. With the Z Tengwa is really wonderful, beautiful connection. So in 2001, I was in San Francisco. Rinpoche came to Berkeley, so he gave a public talk. So I went there, of course, to receive his public talk. But at the end, I got a chance to go to see him in person. So he asked me where I'm from. So I said, I'm from Lhasa, graduated from medical school in Lhasa, but I'm here as a student visa, but I do not want to give up my knowledge of Tibetan medicine, and I want to work anything that related to Tibetan medicine. So if Rinpoche can help. So Rinpoche said, send us an email. Then he kept me connected. He said, just wait for a couple of weeks, you will hear a letter from us. Obviously, Dr. Phuntsog is on her way. I didn't know. So we got connected ever since 2001. So that's a two connection, how I connected with the Rinpoche. And then 2015, again, I did a few of the classes with the Rinpoche in New York, but 2015 was main initiative starting point for the Stanford. So my point is, just like Rinpoche said, Tibetan medicine is not only for Tibetan people. It has the beautiful, inspiring knowledge that can inspire and provide a lot of benefit to the humanity. It does not matter with your races, your ethnic group, your religion, your language, you can all work. So I really believe that, and I see there are a lot of blind spots through the Western medicine. I'm sure in Tibetan medicine, we have our own blind spots, but through the Western medicine, there are many things they don't see under the microscope, but things are exist. So I know that, and I shared that with the director at Stanford, along with his help. So also, I was invited to Stanford a few years ago at the anthropology department. So we all got together. So we started to initiate the first conference in 2016. At that time, then also my one of my staff, also a relative who came. So we all joined together to starting to set up the symposium at Stanford. So we had a 2016, 17, 18. And 19 we didn't do. We were going to do something in 2020, but because of the pandemic, we postponed it. So as soon as things goes down, then we can starting to plan more. But this is the major thing. What we focused on is the pain management in Tibetan medicine and integrative way of Tibetan medicine and Western medicine, how we can complement to each other, not to alternate, but to complement, but also moving forward and to providing the holistic view of Tibetan medicine for the mind and body health. Then we did the individualized or personalized care, which is a very new concept in the Western medicine field. But in Tibetan medicine, it has been practiced for 1,000 years. So I see all those beauty of Tibetan medicine, and I want to share this knowledge and benefit the humanity. Yeah.
Thank you. Yes. Yeah, that's right. The individualized medicine is pretty much the basis of the theory in Tibetan medicine and other traditions of Eastern medicine. But this is kind of a brand new idea in the Western medicine, but it's a big idea because in the Western medicine, they're very excited about this prospect of individualized, customized medicine for each person, as opposed to a model of like a one size fits all. And so we're seeing a lot of focus and research and excitement in the Western medicine world about this idea. And so I'm really glad that yourself and other projects are working to integrate the many centuries and millennia of history of the Eastern medicine to inform and in some ways guide and to participate in that process. I think it's wonderful. And at any rate, as having the honor to participate in this symposium, it really was just a fabulous opportunity and a wonderful event of collaboration. So I certainly hope that it moves on in the future. And thank you for your work to organize that. So Dr. Kalsang, as we get towards wrapping up here, is there anything else that you would like to share with us about? I had one more question. I had a question I'd like to ask. So what do you feel is can you talk for a few minutes, just a little more specifically, how do you see the most important application of Tibetan medicine for the kind of Western modern life in the United States, for modern people in the United States, complementing the Western medicine? How do you see the most important aspects of Tibetan medicine that we work with in that sense?
Okay, so in general, there are a lot of there are 2 points. One is working with your mind, because you can teach the patient to train their mind. And that's a one day, sounds really big project, but you can work with the breathing exercise. It makes really, I say this is like almost homework that they can take at home for patients. But a lot of patients come here through the Western medicine, either being diagnosed but no clue. So what we do, so through Tibetan medicine, the most applicable, I teach them finding their own constitution. Then once that one is set, that they can finalize, or they can know what type of food they need to eat. Not the everyone should to eat. You know, everybody on the market says garlic is good for you. Everybody should eat garlic, but may not be particularly good for that person. So we particularly teach the lifestyle and diet. This type of thing are very useful and applicable, and also really almost like a costless, right? Once you know the knowledge. So this is one of them. And am I answering your question?
Yes, yeah, absolutely.
Okay.
The
So
diet and
another
lifestyle
thing,
is so important.
yeah, another thing is that we also teach a lot of self-healing techniques to the patient, because it's not that easy to for patient to come to the clinic often. I'm thinking about like an in-person clinic, like in general, but a lot of people live far away. So I teach a lot of like self-healing techniques, then they can apply at home. Then they can also do their medical checkup with their MDs, but they find it fascinating what changed.
Yes, that's very useful for empowering people with some tools and insight into their health and some home care. So, Dr. Kalsang La, if people want to connect with you and learn more about your programs, or if people are here in the San Francisco Bay Area and want to come and see you in your clinic, how can they contact you, and how do we learn more about your programs?
Okay, they can go on the website, the famous triple www at Kunde, Kunde wellness.org. So once you see the website, everything is there. But if it is easier to write the phone number, here is the phone number: 415-681-1643. 415-681-1643.
Thank you. We'll post that in our comments. Well, Dr. Kalsang, thank you so much for joining us today, and thank you for all of your work, and congratulations on being able to open your clinic and work with your friends, as Menpa Wangmo said, your dear friends who come to see you. And thank you, and we certainly look forward to what is coming up for the future.
Thank you. Thank you for hosting. Thank you, everyone.
Menpa Wangmo La, would you like to say a few words to close, and any final thoughts on our topic for today?
So now I don't have so much things to say already. Dr. Yangdron did good, because we are almost every day talking. So the only one things I want to say is like so now every medicine is good. Western medicine is very wonderful, such amazing. Chinese tradition, Chinese medicine also wonderful. Ayurvedic as well as also homeopathy and then naturopathy, all those medicine. Every medicine has such a high power potential. Inside that, the Tibetan medicine is very new. I remember one time, often people asking, what's the different Tibetan medicine and then the traditional Chinese medicines? And then at one time someone asked it, and then in New York also, I think the Dr. Yangdron was with me, and then we are together. And then somehow we are with Rinpoche at that day. And then Rinpoche said, why you don't tell the difference is Chinese medicine, everybody knows. Tibetan medicine, no one knows. This is one big difference. So that's always I remember whenever someone asks me is what's the difference, almost I'm going to say different. Chinese, you know, and the Tibetan, you do not know. So this is the different, you know. So this is sort of like a simple difference. Yeah. So the Tibetan medicine is sort of like people knows Ayurvedic, this, that, and then they do not know the Tibetan medicine. So I think it's very useful to know that what's the Tibetan medicine. Either you want to study further or not, this is not the main point. But simply to know what is hot water is benefit. Very simple. To boil the water and the cold water is too big different. Anyway, we need to drink water no matter who you are. We have to drink something liquid every day. And then when you drink, just simple change, that cold water change into the boiled. Boiled means is when you drink, do not need to drink very hot. You drink what is the temperature is good for you. But the hot water helps you to restrain your metabolic systems, cleanse all your digestive systems. And then the increase the metabolic systems, clean digestive system means is all what you eat food. Either like the organic food or non-organic food is not important. And then better abstract to the body, observe to the body is better. I'm not saying is the organic, non-organic is the same. I'm not saying, of course, organic is better. But it's the either what you eat the important is to have the clean digestive system and the good metabolic systems. If you have these two good, and then whatever you eat, the body going to abstract well, observe well. If that happened, and then today we are talking, everybody we talking is we should have a good immune system. Why? If we have immune system strong, then hopefully able to prevent this pandemic disease virus. If we wanted to have the strong immune system, you should drink hot water, which is a boiled water. Very simple, no cost, hardly. So this is sort of like this kind of thing is in the Tibetan medicine. That's very simple, easy to access, applicable, and big benefit. And this kind of thing is very important. So the Tibetan medicine is like very holistic. The theory of the Tibetan medicine is very integrative. And then the practice of the Tibetan medicine is very holistic. Basically, everything what we do is part of our connected to our healthcare. Either positive way help or the negative way harms. So all those kind of things, movement, singing, dancing, breathing, meditation, so on and so forth, all this kind of like under the Tibetan medicine. So which means is we can utilize those things into the healthcare. In the Tibetan medicine, we say so first, we try to be healthy, no sick. If they're sick, then we have to go to the doctors. That is not the best option. The best option, we try to prevent the disease. So in the Tibetan medicine, there's a lot of things to how we can prevent, as I said, like drinking hot water. So this kind of like the will be good. Each of you have sort of like a small, simple knowledge of the Tibetan medicine. So anyone interested to learning more Tibetan medicine, then yes, you can go to the Shang Shung website. Either you can go to Shang Shung US, or you can go to Shang Shung Russia website, or you can go to Shang Shung Tenerife in Spain. So you can find the simple informations there. Also, you can directly connect to us, and then we have like a qualified people we can provide. And also, if you needed more doctors, as we said before, you can contact to the Atma. Also, we have qualified practitioners. They listed in the Atma website, so also you can find someone near your regions. And then thank you, Dr. Yangdron, be with me today here. And also thank you, Adamla. Wonderful job. And then Matthew. And also all the team. So that's I want to say. And then special, I want to say thank you, all the listeners. And also please share with other people. Maybe someone can benefit, hot water can benefit to many other peoples. Thank you. That's I want to say.
Thank you so much, Menpa Wangmo. And this has been a delightful conversation. Thank you both, my dear teachers and friends and colleagues, both of you. It's been a wonderful time to share with you here. And thank you. Yes, I want to echo your thanks to all of our listeners. So please, if you want to connect with Dr. Yangdron Kalsang, please go to kundewellness.org. And if you want to connect and learn more about the Shang Shung Institute School of Tibetan Medicine programs, please visit TibetanMedicineSchool.org. And again, if you want to seriously study Tibetan medicine in a very profound way, then we have our 4-year program beginning in the January of 2021, our new cohort. In any case, please like and subscribe and follow us on the social media. We have a collection on the YouTube, and also if you want to check out our previous episodes of this webinar series, you can check YouTube or on our homepage as well, TibetanMedicineSchool.org. And please join our mailing list for important updates and announcements. Thank you so much, everybody. We wish you the best of health, many blessings, stay safe, stay well. And this has been the Shang Shung Institute School of Tibetan Medicine webinar series. I'm Adam Okerblom, and we will see you next time. Thank you.
Thank you.